Hello, my name is Christina Murphy. I'm a third year at the University of California, Irvine, and this is my public health profile on malaria. Number 1, public health problem. Malaria is a problem that exists in society today. It is a serious and sometimes fatal disease that affects nearly 1,700 in the US and 219 million in Africa yearly. It causes so many illnesses and death that it drains the national economies that are already poor. This maintains the cycle of disease and poverty in the most prominent malaria-ridden areas including Africa, South Asia, and parts of Central America. How is malaria contracted? It is spread when an infected Anopheles mosquito bites a person. It can also be contracted through the use of dirty needles that were previously used on patients with malaria. I have included a graphic that shows the percentage of malaria sites reported in 2009. As you can see, the disease is heavily concentrated in South Africa, parts of South America, and parts of Asia as well. Public health problem continued. Where does the disease occur? Malaria is typically found in warmer regions of the world, in tropical and subtropical countries. Transmission occurs in areas with standing water, including lakes and swamps. Most cases are reported in Africa, South Asia, Central and South America, the Caribbean, Southeast Asia, and the Middle East. I've also included a picture of the mosquito that transmits the disease. Etiological factors. Children under the age of 5 and pregnant women are more vulnerable to malaria. Among pregnant women and children under the age of 5, travelers or migrants from areas with no malaria transmission who lack immunity are also vulnerable because their body doesn't know how to fight the disease. Future risks for community. Climate change makes a more optimum breeding ground for mosquitoes carrying the Plasmodium falciparum parasite. There's also an increase in severe anemia caused by ruptured blood cells, which is an effect of malaria transmission. So not only is there a risk in the amount of cases of malaria, but there is also the risk of an increase in anemia from this disease. 2. How to solve the public health problem. There are two strategies. Strategy number 1. In 1955, the World Health Organization launched the Global Malaria Eradication Program. This relied on the drug chloroquine for prevention and treatment of malaria and the chemical DDT for mosquito control. Since the implementation of this program, 15 countries eliminated malaria. Strategy number 2. Research has been conducted on developing effective malaria tools. Some of these tools include long-lasting insecticide-treated nets, rapid diagnostic tests, and artemisinin-based combination therapies. These tools have made malaria incidence decrease by 37% between 2000 and 2015. I have also included a graphic of the 3 pillars that make up the Global Technical Strategy for Malaria that is launched in 2016. These pillars represent the essential components that are going to be used in the future to help treat and prevent malaria. How to solve the problem continued. There are 2 examples of how malaria was solved in other countries. The first example is the World Health Association European region, which succeeded in reducing the cases of malaria as 8 regions reported 32,000 cases in 2000, which decreased to only 5,000 region-wide in 2005, and then only 179 in 2010. This elimination was made possible through high-level political support, strong effort in programs of affected countries, and financial help from the Global Fund. Example number 2 comes from South Africa. South Africa has reduced its number of reported malaria cases by 64,000 to 11,700 between 2000 and 2014. South Africa has dramatically reduced their numbers through targeted action and cross-border collaboration. 3. Public health in the future. How to prevent malaria. Malaria can often be prevented by using anti-malarial drugs and protective measures. The CDC recommends these protective measures: applying repellent to exposed skin, wearing long-sleeve clothing if outdoors at night, using a mosquito net over your bed, spraying repellent on clothes, and spraying insecticide around your bedroom before rest. The Global Technical Strategy for Malaria has outlined 5 core principles for future prevention of malaria, which include tailored responses, country ownership and leadership, strengthened surveillance, equity in access to health services, and innovation in malaria control tools. My opinion. I think that although the CDC's suggestions are helpful for travelers, the accessibility of insecticides and repellents and nets may be limited to those indigenous in the areas most affected by malaria. The use of anti-malarial drugs may be more helpful for those living in the heavily infected areas, and I also believe that the 5 core principles that are outlined by the Global Technical Strategy for Malaria and are essential for a malaria-free future. Here are a list of my references, and thank you for watching my presentation.